We're going to Professor Igor Stojkovski. He's head of the Oncology Clinic of the University of Radiotherapy and Oncology in Skopje, North Macedonia. And also he's experienced with using best practices and strategy for implementation. So we are very keen to hear your experiences.
Thank you for your invitation. Macedonia is a tiny country, I mean around less than 2 million population. We are facing, for instance, increasing number of cancer patient per annual incidence is increasing. We have approximately 7,500 new cancer cases annually, from which around 5,000 new cancer cases are ending in University Clinic of Radiotherapy and Oncology in Skopje, in the capital, because as previous our people, head of Health Insurance Fund and advisor of the Prime Minister stressed that we have much centralized cancer care. All public cancer care is concentrated in Skopje, in the capital. So, and in the past several years, we have established a population-based cancer registry on the country national level. This was done by EU funds, EU-assisted project. So now we are practically collecting national cancer-related data on the methodology by USCC, I mean, methodology of the cancer associations. Also, we have established we are becoming a part of EU Melarec, which is a registry dedicated and specified for melanoma patients and for other skin cancers. Also, we are, let's say, facing some challenge to establish on this most frequent cancer cases, breast cancer, specific disease-related cancer registry, also lung cancer. This is a project which I hope we will implement during next year. So collecting data in this disease-specific cancer registry will have much better data to plan cancer development. So in the past several years we have established, because in my country, our specialization is still clinical oncology. So in Macedonia, doctors, oncologists are covering both chemotherapy and radiotherapy. So we are combining specialties. So we have established also long-term relationship through the projects with International Atomic Energy Agency. We have developed our capacity building, equipping of some of the part of our institutions. Also, regarding the testing of the molecular testing, now is covered by Health Insurance Fund. At least all molecular testing for specific cancers, for melanoma, for instance, for colorectal, for lung cancer, breast cancer, is covered completely and is free for all patient in public health system. Also, we have increased the oncology budget through conditional budgeting procedure. Let's say, through this conditional budgeting procedure, we succeed in putting 23 innovative drugs on the list, and they are completely free for patients who are treated in public oncology system. Also, this means that we have significantly increased budget for oncology, which is between threefold if you compare this year with 3 or 4 years before. But this is not enough. Normally in oncology, we need much more budgeting to provide all cancer care. So, and generally, as we are becoming, or we are on the road to becoming EU member state, we need to equalize our cancer care with all other European countries. So because people are let's say, we are part of this EU space, yes. So I believe that also people are traveling, people are moving to European, but generally we are facing these challenges of not just the funds, but also human resources, because we have a lot of people we are facing this brain drain. I mean, keeping the people qualified personnel in all areas of medicine. So I believe that also this idea, I mean, to hear a voice of Macedonia, that we are not caring only for patients, but also for caregivers. Sometimes caregivers are leaving the country, or patients are leaving to be treated. So these are the challenges that we are facing in general, I mean, so.
Yes, thank you very much. Interesting that you also, by collaboration, EU collaboration, this population registry was established.
It is established, but the data is not still mature because practically we are filling this 2 years. I mean, we'll have more reliable data now on incidence, stages of disease, but we are still struggling to obtain let's say, to have a survival data or disease-specific data.
Yeah.
For melanoma, we'll have probably for next year, because this is specific disease-related data. So we'll have maybe some information for survival before introduction of, let's say, biological modern treatment and after. So because we are practically not just prospectively, but also retrospectively entering a particular data. Yeah. So, but soon, I think, during next year, we'll have some threshold of data.
Mm-hmm. And you mentioned also capacity building. So what kind of capacity building was needed as a result of, or consequence of the...
Generally, we are facing, because we are covering, like I mentioned, 2 specializations in one. We are clinical oncology, covering both radiotherapy and oncology. So in all country, we are, let's say, around 30 active clinical oncologists. We are covering needs for the country for radiotherapy and oncology. Plus, normally we need more pathologists on the level of country. So we are now discussing something strategic things to be done with government. I mean, more to give advance to people who want to be more involved in specialization of oncology, radiotherapy, and pathology, which are generally in specialization in deficit.
And if so, in the next step, so where would you ideally see your support or further collaboration?
Generally, normally we will need funding, some source of funding for. I don't know if this is possible through different levels of support from the industry, I believe, from organization, from funding, and then to obtain educational level of the younger generation. I mean, to be on the level of EU specialists. But if you taught them to treat patients on the European Union level of let's say developed country, then you need to provide all these necessities. I mean, access to the drugs to the patient, access to the equipment, access to diagnostic methodology or diagnostic things. So we need to develop education together with to be environment to practice oncology in the countries.
Yeah. So that would be like a sort of training network?
Yes, training network, yeah. and to have, and also we were discussing about dispersion of the system, to have better access to some types of treatment out of the capital. I mean, so, but we need then to give to the doctor specific competencies, I mean, for which procedure they can perform out of the centralized, central institution.
Mm-hmm. And do you think the sort of training networks among the Central Eastern European countries could be improved?
Yes, they can improve. All this movement of the sending people to scholarship to education, or receiving somebody like expert for any kind, I mean, of oncology assistance.
Do people agree that there's a need for better, let's say, collaboration among, for training networks in oncology in the region?
Yes.
Yeah. So that's another.
Yes, also access of the drugs could be more easily through the clinical studies for the, let's say, to have easier access to multi-centric clinical studies.
Mm-hmm.